Your liver is silently begging for help, and ignoring it could cost you. Stay with us here at Good Cuppa Health to learn how you could potentially help. Did you know that fatty liver disease is the most common liver disease around the world? According to the University of Utah Health, life expectancy with fatty liver can be 10 to 15 years if it develops into fatty liver steatohepatitis or non-alcoholic steatohepatitis cirrhosis or NASH cirrhosis. Issues like gastrointestinal tract bleeding or abdominal swelling can reduce life expectancy to 3 to 5 years unless a liver transplant occurs. Currently, at the time this video was made, no medications or surgical procedures specifically target this condition. Some of you watching may be asking the question, how to treat fatty liver disease? Following a treatment plan is the only reliable way you can reverse fatty liver disease. In this video, we explore the many fatty liver treatment options you could incorporate to increase the chances of reversing this condition. Treatment options to reverse fatty liver disease. Number 8. Lose weight. If you are overweight or obese, creating a weight loss plan would be the most effective way to reduce fatty liver disease and improve liver health. According to the American Liver Foundation, it's estimated that more than 70% of overweight people and 90% of obese people have some form of non-alcoholic fatty liver disease. Losing 3 to 5% of your body weight could treat non-alcoholic fatty liver disease, or NAFLD. However, if you have non-alcoholic steatohepatitis, NASH, or liver inflammation, you would have to lose up to 7% of your body weight to reverse the damage. Ideally, you should lose no more than 1 to 2 pounds of fat per week to reduce fat from your liver. If you find it hard to lose weight naturally, you may benefit from weight loss surgery to get the support you need to reach your goals. Online calorie counter websites can help estimate how many calories you would need to eat to lose 1 to 2 pounds per week. Number 7. Manage your diabetes. Up to 70% of people with type 2 diabetes may have fatty liver disease. If you have type 2 diabetes, make sure your blood sugar levels remain within the ideal range to help treat fatty liver. Check your blood sugar levels regularly, and make sure you are taking your prescribed diabetes medicine on time and following a diabetes-friendly meal plan. Number 6. Lower your triglycerides. You could lower your triglycerides through medication and eating fibrous foods. Fibrous foods have been shown to lower high triglyceride levels, so include more fibrous foods in your fatty liver diet plan. Number 5. Get regular exercise. Exercise reduces liver fat, and some experts have said it could be, quote, the first-line treatment in fatty liver disease, end quote. It helps regulate insulin, and insulin irregularities are often associated with fatty liver disease. Also, if you have type 2 diabetes or high triglycerides, exercise can help you control these conditions. Dr. Jonathan Stein, Associate Professor of Medicine and Public Health Sciences and hepatologist at Penn State Health Milton S. Hershey Medical Center, stated, "Our findings can give physicians the confidence to prescribe exercise as a treatment for non-alcoholic fatty liver disease." End quote. The Centers for Disease Control and Prevention recommends at least 150 minutes of moderately intense exercise a week for overall health and well-being. Number 4. Pay attention to what you eat. Watching what you eat is the most effective way to reverse fatty liver disease. Avoid or severely limit fried and processed food, refined grains like white bread, added sugars, salty foods, and saturated fat. These are some of the worst contributors to fatty liver disease. Similarly, cutting out alcohol will benefit your liver's health. It's also important to limit or avoid sugary and sweetened beverages as they contain some of the highest amounts of sugar, especially in the form of high fructose corn syrup. Consuming a lot of high fructose corn syrup could increase your risk of non-alcoholic fatty liver disease because the liver converts the excess sugar into fat. And research from the National Institutes of Health suggests that high fructose corn syrup damages the intestinal barrier. Our intestinal barrier protects our bloodstream from toxins and bacteria. Without realizing it, it's easy for us to overdo it on sugary and sweetened beverages because they don't get us full like solid foods. So we have to monitor our consumption. The Mediterranean diet is considered one of the best fatty liver diet plans. It gained popularity in the 1990s and is the most recommended diet today. It doesn't really consist of a disciplined or rigid diet plan because it focuses more on changing your eating patterns. It recommends eating low-sugar fruits, veggies, whole grains, beans, nuts, legumes, high-quality olive oil, and flavorful herbs and spices. It also recommends fish and seafood at least twice a week, a moderate amount of eggs, cheese, and poultry, and cutting back or limiting red meat and sugar and sweets. This diet is often recommended because it could reduce or prevent bad LDL cholesterol, high blood pressure, heart disease, and non-alcoholic fatty liver disease. Even though the Mediterranean diet is recommended, some foods stand out for their liver health benefits and should be incorporated more frequently. These foods include apples with the skin. You know the saying, an apple a day keeps the doctors away. Well, this may hold some truth, especially for fatty liver disease. While fruit recommendations are mixed because of their sugar content, apples could be an exception. Apples may help reverse fatty liver disease because they contain polyphenols, pectin fiber, and malic acid. These compounds could help regulate the liver's fat and serum levels. Malic acid could assist in removing poisons and carcinogens from the body, allowing the liver to detoxify better. Also, apples have anti-inflammatory abilities that could protect the liver and help it cleanse itself. You should eat the apple skin because that's where most of the fiber is. Now on to beetroots. Beetroot has several compounds that could defend against injury and boost liver health. It is one of the most recommended foods to include in a fatty liver treatment plan. In research studies, it prevented fat from gathering in the liver. And researchers noted that when you combine beetroot with a Mediterranean-style diet, the protective effects of this vegetable are enhanced. Beetroot should be included in a fatty liver diet plan. Let's add garlic to the list. Adding garlic to your diet in supplement or raw form could help reduce body fat and reverse liver fat buildup. Studies have revealed that garlic positively affects liver enzymes such as gamma-glutamyltransferase, GGT, and alanine transaminase, ALT. These two enzymes are usually high in people with fatty liver disease, and garlic may help lower them. Garlic may also help with insulin resistance and obesity, two factors linked to non-alcoholic fatty liver disease. A 2020 study discovered that ingesting 800 milligrams of garlic powder for 15 weeks, quote, significantly improved fat buildup and comorbidity risk in people with non-alcoholic fatty liver, end quote. Preclinical studies revealed that garlic could reduce non-alcoholic fatty liver, hepatic steatosis, oxidative stress, and inflammation. Garlic may also speed up your metabolism, helping you lose more weight. How about some goji berries? Goji berries have many antioxidant properties and may also speed up weight loss. Goji berries are called liver healers and are sometimes recommended for liver problems. Let's add berries to the list. Berries like bilberries, blueberries, raspberries, and cranberries are low in sugar and rich in antioxidants like anthocyanins, which may help reverse this condition. Researchers stated that a higher intake of anthocyanin-rich foods could reduce the risk of non-alcoholic fatty liver disease in adults. They should be included in your fatty liver diet plan. Let's also add some grapefruit. Grapefruit contains naringin, a compound that may reduce oxidative stress and defend against alcohol-induced liver steatosis. It's important to quickly mention, if you take medications that are metabolized in the liver and want to eat grapefruit, consult with your doctor. Grapefruit can block the absorption of some medications, and your doctor may advise avoiding grapefruit or only eat it at certain times. High-quality extra virgin olive oil. Olive oil is the staple oil of the Mediterranean diet and contains healthy fats with appetite-suppressing properties that could keep you feeling fuller longer. It contains oleic acid, a compound that interacts with nerve endings responsible for hunger sensations and could trick your brain into feeling full. It could also regulate liver enzymes and reduce fatty liver disease. A registered dietitian from the University of Chicago Medicine recommends high-quality olive oil to reverse fatty liver disease. Next on the list, organic whole vegetables. Whole vegetables like spinach and broccoli could work wonders for liver health, and vegetables could reduce the buildup of fat in the liver and slow its progression. Vegetables like spinach and broccoli could help break down the existing liver fat, kickstarting the fatty liver reversal process. Next, walnuts. Walnuts and tree nuts in general are high in healthy omega-3 fatty acids, antioxidants, and fiber, making them beneficial to reverse fatty liver disease. A 2021 study revealed that eating a handful of walnuts 5 to 6 times a week could have a positive impact on reducing liver fat and benefit overall health. Additionally, walnuts have some of the highest antioxidants and omega-3 content of all tree nuts. Next, you might be surprised to see coffee on the list. Coffee lovers will rejoice when they learn that coffee may reduce liver scar tissue from inflammation-related fatty liver disease. When your body digests coffee, It produces a metabolite called paraxanthine, which could slow down the development of liver scar tissue. I should mention that even though there are potential health benefits to coffee, you should also drink more water because caffeine can have a mild diuretic effect on your body. Experts recommend drinking at least 1 to 2 extra cups of water for every 100 milligrams of caffeine you ingest. 100 milligrams of caffeine usually equates to about 1 8-ounce cup of coffee. Also, it's recommended to drink coffee after you eat, as experts don't recommend drinking it on an empty stomach. I have a quick question. If you have fatty liver disease, have you tried any of the suggestions mentioned so far? If you feel comfortable sharing, tell us in the comment section. You never know, your comment may help someone else. Number 3. Drink water. Stay hydrated. Water is so vital for our bodies, especially our organs. Water could reverse fatty liver disease because it helps the liver detox, filter, and remove the substances accumulated from the food we eat, the beverages we drink, the particles we inhale, or even product residue from our skin. Being dehydrated can lead to these substances piling up in the liver. Drinking water and staying hydrated can also help regulate anti-diuretic hormones like vasopressin. As Leah Matlis points out in her book, 25 Golden Rules to Live By for Successful Weight Loss, when our body is chronically dehydrated, vasopressin increases, making this hormone increase blood sugar, which becomes an added burden for the liver. Research shows that high vasopressin levels can contribute to the development of type 2 diabetes. If you have type 2 diabetes, you may have higher vasopressin levels than the general public. Staying hydrated is one of the most important steps to add to fatty liver disease diet plans. Number 2. Try to get more sleep. We live in a society where surviving and functioning on less sleep gets bragging rights. This concept of doing more and sleeping less makes some of us feel good, but this mindset is not good for our health, and many studies show the harmful effects that a lack of sleep and chronic sleep deprivation have on us. Chronically depriving our bodies of sleep leads to hormonal imbalances, ages our skin faster, increases heart disease and heart attack risk, increases blood pressure, reduces cognitive function, and more. Research is also starting to show a link between chronic sleep deprivation and fatty liver disease. Sleep is vital for our body's rejuvenation process. During sleep, our bodies heal themselves, release hormones, remove dead cells, and so much more. Aim to get at least 6 hours of sleep a night. Number 1. Supplements to potentially reverse fatty liver disease. Milk thistle. When combined with a fatty liver diet plan, milk thistle may help reverse this condition due to its health-enhancing properties. This flowering herb is part of the ragweed family, and some sources state it could be beneficial for individuals who are trying to reverse fatty liver disease. Milk thistle contains a substance called silymarin, which is said to help repair liver damage caused by fatty liver disease. Milk thistle is available in supplement form. Other herbs and extracts worth mentioning for potentially reducing fatty liver disease include artichoke, turmeric, and dandelion root. High-quality omega-3 supplements. Research shows that taking high-quality omega-3 supplements may accelerate your fatty liver recovery. More specifically, the DHA in omega-3 may have a better effect on reducing liver fibrosis than EPA, per research from Oregon State University. Also, eating foods high in omega-3 may help reverse fatty liver disease, and they include fatty fish, walnuts, chia seeds, flax seeds, eggs, algal oil, and edamame. Conclusion. If you are trying to reverse fatty liver disease, there are no shortcuts. Combining a healthy diet with regular physical activity may be the best way to treat this condition. This video lists the most suggested foods you should incorporate into your fatty liver treatment plan. It is recommended to consult your doctor before making any health and lifestyle changes. Also, your doctor may advise against eating certain foods or supplements mentioned in this video, even if they are healthy. Always remember, this video is for general and informational purposes and must never replace the advice of your healthcare provider. If this video has been helpful to you, liking it would mean a lot to us. What that does for us is it gives us an indication that we are building an audience and that we are creating helpful content for our viewers. It also lets YouTube know you found our content useful, and this helps us reach more people who may want to reverse fatty liver or expand their fatty liver treatment plan knowledge. Thank you for watching.